I'm a registered nutritionist and I'll be your host. In our previous sessions, we have discussed various topics, so several non-communicable diseases. We've done hypertension, we've done diabetes, we've looked at nutrition management of these conditions. We've actually looked at nutrition in autism. We've looked at so many conditions. Now, today's talk is a bit special because rather than focusing on one condition, it is going to look at nutrition in comorbidity, management, prevention, so having more than one condition, or maybe multimorbidity, I'm not too sure. And to lead today's discussion, we have our nutrition and health consultant, Dr. Gertrude Wafula. It's a pity we can't see her face because there's a technical hitch with her camera. But yeah, she's been here before, but I'm going to leave her for her to introduce herself again, just for people who haven't met her before. If you have any questions, please drop them in the chat box. If you're on Facebook, YouTube, please drop your questions in the chat box and we will pick these questions and address them for you. So without further ado, I am going to hand it over to our guest speaker, Dr. Gertrude Wafula.
Thank you so much for the introduction and welcoming me again to the team. I am so excited to be with you, but unfortunately, the computer says no to my face and you have not been able to see me. I'm hoping in between, we are going to be able to have a miracle happening. But meanwhile, I hope we can be able to discuss and share and just hear my voice as I see you, and we find convergence in between. So excited again to be with you. And today I'm going to talk about comorbidity, management and nutrition. And as Anyango has said, you have been doing very interesting things. I promised myself to come again, but I've just been a little bit busy. So I hope this health talk again connects us together. So Gertrude Wafula is my name, public health nutrition. I work also a lot around reproductive and sexual health. I train, I'm a consultant. I work with different professionals, small organizations that want really things really to move, interior writing, supervision, training, just name it. So I bring a lot within the community, but in different aspects. But today, I am going to talk about comorbidity. Look at the definition. I know you have already been given a definition, and why does it actually matter? And looking at nutrition and other conditions that we might be having, how do we actually go on managing this? So that is the talk today. And please, if you have any question, and sometimes I talk really very fast, just allow me breathe in and say, breathe in at least. We can't get you, so please be free to let me know if we are not able to communicate. And if there's any question, please, my dear, I will be able to ask and let me know, let me pause and please help me facilitate where there's a question that we might need clarification.
Yeah, I will.
Thank you so much. So the question is to you all, what is comorbidity? I'm throwing it to the audience, one or two hands to share with me. Any thoughts? Anything coming through?
Not yet. So I think I kind of touched on it at the beginning, having two conditions or more.
Yeah, and you had given the question already, so I wanted to challenge it. Actually, did you people read the message your facilitator had sent? She actually did try to polish this out. So we are talking a situation where people have one or more diseases or conditions within your body at the same time. Simply put, that two illnesses or diseases occurring in one person at the same time. And we are going to look at really what does it really mean if we have that. And usually we talk about long-term conditions, and they could be chronic, which means that you're going to have them a longer time and need to know what they are and how you can actually manage this. So they may or may not be interacting with each other, but may also have factors that actually make some connectivity or association, not every other time, but they may be able to do that. I put this one here that it can include both physical or mental. Mental well-being is a big thing coming in the field of nutrition and the mind. And some old gurus still don't accept that nutrition and mental health we should be talking about. But when you look at it, as we are going to see some of these later on, actually, if your health, your mind is not okay, you're not going to eat well. When you are upset, you get a chocolate and hammer that chocolate so bad. When you're not really feeling good, you're not going to be able to eat very well. When your mind is somewhere else, you don't really feel like you're having the best of what can be, but affects your physical health at the same time. So mental health, physical health, and nutrition are continuing new disciplines that we are discussing, but they make a lot of sense in so many ways to keep on looking at this. There could be a lot of other conditions, and it could be depression, it could be arthritis, it could be diabetes, high blood pressure. I put a few of these because within our communities, some of these things are presenting every other time, and people go through depression, but they just say, you brush it aside. Anyway, it will go. The arthritis or pain is there. I'm just managing. You have diabetes, okay, high blood pressure. Oh, I've had this one so many years, so it doesn't really matter. But it's very, very important that we need to really stop and say, what actually are we having? How is it impacting us? And what does it really mean in the long run? How do we manage this? So it's very important to listen to the body. Now, I've pulled up a few sources that actually indicate comorbidity being an issue. And some of these things could just be randomly together. Others are interconnected, like I said. Sometimes it could be genetic, some things are behavioral, some could be because of environmental factors. So comorbidities can be linked to a lot of things, just occurrences between two things. One can trigger the other. You have diabetes, or you have obesity, then you're likely to have diabetes. From diabetes, you're going to link something else. And some of the factors, actual risk factors, could be overlapping. So that you have to work on one, you are actually working maybe on 2 or 3 things that are really affecting you. So one condition can result in a complication from the complication of the other. So then you have that kind of interlink. And then the third condition coming, and then, of course, it affects the other 2. And then you start treatment that again affects another condition. So then you have a circle going on. And that's why it's really, very important that we need to understand the role of comorbidities in our health, even if we are eating, but what's there beyond that can affect our lives? Or what do we have actually that we have not paid attention to? And according to the World Health Organization, 87% of deaths in high-income countries where we are now are due to chronic diseases or conditions. And those ones we're talking about, that actually most comorbidities are chronic conditions. So what can we do to keep on averting that? When you look at this screen here, you'll be asking yourself, and I'm asking you, do you associate with any? I look at depression, I look at comorbidity, treatment, bipolar, quality of life, anxiety, obesity. So you might find yourself, identifying yourself in more than even 4 or 5 of these things. But the question from me to you is, then have you discussed this with your GPs? Have you discussed this with your family or support workers or even families? Because some of the things around mental and health well-being is around whom do you talk to and which kind of network you have around you. So many of these could really be there, but we sweep them under the carpet: cancer, HIV, hypertension, and within our community, issues around reproductive and sexual health. We don't talk about these ones very, very often. We don't talk about things around death and all that. So it's really very, very important that we don't need just forget that they're happening. When somebody has cancer, we just, oh my God, you're going to die. But we know some cancers are treatable. And we know that when we talk, we might get diagnosed early and we get support, especially if we have our men in the group. Prostate cancer amongst our community is really a big thing, and late presentation is really also a bigger thing. And when you have that, of course, your nutritional needs are going to vary. So are we adjusting as per what we have? Mental health again. These are people who use drugs and substance abuse. I know some of members in our community where they drink their alcohol in a cup. Once you start using your cup to drink alcohol, then know there's an issue. You're leaving a glass because a cup, somebody will think you're taking tea. And the issues there, and could be addiction going on. So we always look at substance abuse and alcohol, drug as distance from us. But even drugs that people really suffer from, some people have used just medicated drug we are given and we just get hooked to it. So there could be a lot of these things causing our mental disorders. And when you have what we call a psychiatric comorbidity, that's people who are having dual diagnosis, you're having maybe misuse of drug issues affecting you. At the same time, you have a mental health needs. So all combined together is. And I'm insisting on mental health again because with financial, economic conditions and things are happening around our communities a lot. But people are going to keep quiet. So we need to get people really talking, and that will impact on so many people within if we don't really give this one a going in as a main comorbidity affecting our community. There's no shame in talking. So when you look at the Center for Mental Health in 2015, look at the long-term conditions. I'm going to pick a little bit of my laser here. Look at the mental health long-term conditions here. 30% of the population in England, that's almost 15.4 million people, will really have issues, long-term conditions here. And we shall also have around 20%, almost 10 million having mental health. And these two interacting together here, you can see the impact. It's affecting even children coming in. So it's very, very important that we look and reflect. Do I have a heart condition? Am I having high blood pressure? Do I have a respiratory disease? Am I having issues like dementia? What's really happening in terms of other areas, in terms of your body, joints, of course, diabetes, a bigger thing, and other things like sensory impairment. So we might be having all this within, and we need really to pay attention to see how this is really interacting together. And it matters. Where does it matter? I'm looking at a life where the burden is like this turtle here, carrying a whole brick on its back. So it's very, very important that we get to know the multiple conditions, and sometimes that may be related or unrelated, but yet they are causing a lot of things that are associated together. So comorbidities can actually worsen your health outcome, and they become even more complex and becomes even harder for clinical management. And some people actually don't say something. They only disclose one or two things, and the doctors don't know. doctors only treat what you share with them. They don't diagnose anything by themselves. They get your knowledge and then they use that knowledge to get to know what's really happening. But if you conceal that information, management becomes very complex. So as we continue through getting older, we are talking about other things really coming in because of age, and the cost of healthcare actually increases, both at home and also in terms of just hospital appointments, but of course, treatment and all that. So caring for you even at home will mean that maybe your niece or your cousin or your sister will actually not go to work to be able to support you. So it's not just only the monies we take to the health facilities or what the NHS spends on us, just more than that in terms of cost. So it's very, very important to look at the need for us to be looking at those complex needs to avoid where we have management of the same being a problem. So when it comes in terms of treatment, we are looking at in the UK, like 1 in every 3 persons are actually admitted with more than 5 or more comorbidities. And having 2 or more of these comorbidities result in the reduction in the quality of life. It can lead to impaired function of other parts of the body, the liver, the kidneys, and all that. You'll have worse physical and mental well-being, but it also increases the chances of you actually dying. So we are looking at, even when you go for things like surgeries, complications are there. Like in 2018, it was found that actually more complications arose with people with liver diseases and other disorders, just because of blood clotting, because of comorbidities. So it's just not only around the quality of life, but even the care, the chances that actually you come out of the surgery are also reduced. So we need to look at this really very seriously, what it means. So if you have diabetes, not just diabetes, it's more than what we have. And I was just reading the paper by Ho and colleagues there. They talk about a lot of things around really how comorbidities actually affect the quality of life and the treatment that's available there. So we're looking at causes. Could be demographic, I said it could be genetic, it could be biological, environmental, physical, or just because we don't go access healthcare. And this is a big one for us. Late presentation, or we don't access healthcare at all. And then looking at what would have most of these, actually, we look at as really problems now within our community. And we should not really close our lives, because I have just talked about really the consequences here. Mortality is really very high. And what we can prevent, I think we should be doing something around that. But it also makes complex the treatment and care that we really give. That was just a summary slide to show that. Do I have any question until that stage?
Not at the moment, no.
Okay. Now, I just went ahead and looked at, is this just our problem? But I also looked at and found that even the US, a number of people within our communities also present similar things. And when you look at people who have maybe TB, people who have HIV at the same time, you have diabetes, you have high blood pressure, all those ones together are a lethal package. But then, when you just look at this, I hope it's a little bit smaller, but maybe it could be, you see this. This person has diabetes. Of course, maybe with old age, but also with not having enough to buy maybe quality food, you are malnourished, you are anemic, and you have also high blood pressure. Now look at the chances of you now having that comorbidity. Diabetes and high blood pressure here interacting, affecting almost 6% there. So whenever you put all together here, the multiple bits here, 1.2, you are going to exhibit almost all these conditions together. So you find that the more conditions are in, the more there are going to be an interaction. And the more you have your body mass index going above 25 or 24, sorry, or 27, then you know what that really means. So even with the young people who have really lower BMI, when you have all these conditions in together, then there is really a big problem that you are likely to get more than a 2 of all those things really get together, interacting and causing a lot of issues in our body. Again, I'm just looking at...
I have a question, thanks to me. So is comorbidity not a problem for the aged only? I think that's what the person, because you said when young people, you said something about young people. I guess the point is it not an issue mainly for elderly people? Can young people have comorbidities?
Yeah, young people can have comorbidities because we have even diabetes among us. We have young people who are diabetic, but they're also obese. At the same time, they have high blood pressure. At the same time, they have maybe asthma. Then all other things will come in. So and that takes my little slide where I was saying that it actually affects everybody in our all walks of life. And the question is, are we attentive to know what other conditions actually people have and how are they interacting and what is really happening in the general well-being of the people? So young or old, you can have all that, and comorbidity, when you get even older now, age now comes in and they make even things really complex. But being diabetic alone or obese alone, that is a different ballgame where things really become really more a problem to think about. Yeah? Okay, thank you for the question. And I'm just looking at a community that's white and our Black community. And here looking at even somebody who has 27 BMI, this is overweight. Is not this is somebody who is overweight. But look at when they have asthma. You see the problem they are now getting really. When they have cardiovascular diseases, then they have all these other risks are really high. You have stroke, they have diabetes, then anemia coming, interacting. So within our own population, just compare the white and the Black community, we're already predisposed because of the race. So there's so much we need really to pay attention because all these other comorbidities risk our survival in so many ways. And if you look at the prevalence amongst people who have the ages between 40 to 79 by race, this was a US study, I just see how will I say, the pointer to say we are actually more exposed or prone to all this. So we need even to tread better because our ethnicity alone exposes us to even further risks without even the environmental and what you have.
Dr. Gertrude, can I just come in here? I just want to hear your thoughts on this. I mean, it's something we know, we keep hearing, but do you have any thoughts on why we have a higher risk? Because you're looking at hypertension as compared to any thoughts at all on why we seem to have a higher risk?
There are different things you can talk about. Of course, let's leave just genetic alone because genetically we are predisposed. The second aspect that we really have on is we actually eat rich. We eat rich in the way we prepare our food. Like look at the Asian community. And even when you're preparing your beans and all that, it's the good food you do. But you are going to use your palm oil, you are going to use your ghee, you are going to use, so the preparations actually is where you're introducing all these other things in. If I say you're taking only 2 slices of bread, but if I ask how much butter actually do you put on your bread, it will be almost a whole spoon. If I say I'm making you tea, you'll ask me, oh, three spoons of sugar, please. When somebody's taking even nothing in. So there are little things from condiment things we put in. And if I say, can we have a walk? You'll ask me, why are we walking? What are we going to do? Where's the purpose? So there's so many things that we have accustomed as cultural that we do things the way we do. Let's cook the way we cook. You can still make better food, still the same food, but just adjusting the quantity of oil, the way how we prepare it, and looking at different ways of really indulging without overindulging. Portioning is the other thing.
Yeah.
If we say, okay, I've just gotten very nice jollof rice, my proper Caribbean chicken there, fried. Surely, are you going to tell me just take one piece? I'll tell you no, I'll have to take two. Just not 2 or 3 is an extra kilocalories that you're not going to use, and you're keeping it somewhere. So it is not just only about genetics, but it's also about the behavior and the way we do things, the culture, how it influences. I have just had a meal. I come to you and say, can I please give you? I don't want to be rude. I'll say, okay, please serve me again. So little things we can do to adjust that only follow in. The Asian, of course, the way they cook, almost food are plant-based, but how they cook it is where they introduce all these kind of things. So there are things that are in our hands.
Yeah. So we tend to engage more in unhealthier lifestyle behaviors. Yeah, thank you.
But the funny thing here, Doctor, is that not many people actually know that there's harm going on. And when you're like skinny, we only look at people who have body as, oh, this one has a problem. But we know that fat can be deposited in the arteries and whatever, even if you're skinny, and you die from that. We eat before we can sit to eat. We are asking, can I have salt? You add before you can taste your food. Hypertension, you're just grooming it. So there are things we assume only matter how big body to have a problem. And then we continue doing this. But we just need, I think the education and sharing this knowledge is very, very important for people to be able to see where they can shift and adjust. Why would I eat brown bread when I can get white bread? So a lot in. Take food with low glycemic index. Eat pumpkin instead of eating what? Instead of eating maize meal, because pumpkin will make you really so full, but has only maybe more water in, and you'll feel so full when you're eating. So we need to be very, very innovative in terms of supporting our community.
Thank you.
Thank you for the question. Okay, mental health again. Dietary improvement and physical well-being cannot be separated. When you have when you're eating well, you actually feel good. Your mental health feels really better. And of course, your physical health is also better. If you don't do well, then there's an interlink. So we cannot really do without that as we really work along. And the quality of your diet is very, very important. Look at what are the health fats, limited fast foods, fruits and vegetables, fiber. We are looking at how these good things are interacting with your biological systems and how they're making you really feel. And all these are also going to work and also work on your craving habits and situational factors when you just need to do it because you're doing it. Yeah, let's look at all those habits and how we did the link. But this mental health, again, mood, when you're stressed, people, when they're stressed, they just eat whatever comes their own way. But then again, low risk of illness when you're really eating good, better cognitive function. When you're thinking better, you actually feel better and you make really good choices. So all the things are really interlinked. And if you take away one, the other bits, most people are put on weight when they're depressed. Why? Because you do other things that you not have done. You not walk, you not go anywhere, you're not going to spend even the energy you have because you're depressed. You are depressed. So all this has a very big interlink between nutrition and what we do. Again, you must have seen days during COVID when you have immune system, it's really not good. Other conditions like when you have diabetes hypertension, all this bring even more issues here. And of course, it affects your pulmonary functions, how your oxygen, how you breathe in, having more weight, how that one really happens, again, making your pulmonary function and your lungs not working really very well in terms of oxygen circulation in your body, but also affects your heart, the kidney, and all other parts of the body, inflammation. So one system that's failing can actually trigger all the other comorbidities in. You have one person who has just this, and all of a sudden, what's coming out? All these other diseases coming in. So controlling one side is very, very important for you to ensure that this side is really maintained in good health. Again, here, chronic obstructive pulmonary diseases. With COVID now, we have been having COVID, we have asthma, and all other respiratory diseases. We know these are one of the main killers in the world now, but poor nutritional status, anxiety, poor quality of life, will be experienced when you have that. And other comorbidities again come in. So other abnormalities just come in when you have that, when nutrition is also not really good. So it's very, very important that in any system, you're not just only looking at one kind of disease that's happening around us. There's so much interaction in terms of disease progression. And if you're eating well, you have all these other aspects good. This is contained really better in terms of our respiratory obstructive diseases, which are really very common now. And people who smoke even have more problems than that. So when you look at how nutrition abnormalities, when people have obstructive respiratory problems here, the skeletal muscles are also affected. But now, even when people are now even older, now that becomes even a bigger issue. When you're older and you have chest infections and all that, it's going to really affect how you really live, but also affect your skeletal muscles. And then, of course, to improve more injuries and, of course, stress and other things are also encompassed in. So your nutrition, your skeletal muscles, your ability to actually do things are not going to be okay. And everything is like the whole system is under stress when there's oxygen imbalance in your body. So it's very, very important that we look at some of these factors that actually pressurize or put our bodies in these kind of situations, and ensuring that a physical inability, other comorbidities, smoking, and all these can really trigger or force already with aging and genetic issues, drugs and all that, all combined together, that you're having multiple attacks on your body in a way. So making it really very, very, very difficult to entangle, so like everything is like a biological wheel in, one is leading to the other. And of course, your whole system now deteriorates and you don't really feel really better. So we know that when we don't have good nutrition, we are going to have a lot of issues in the sense that we're going to be going to hospital every other time. So we'll have more morbidity and of course mortality too. So worsening death for most parts, people really go, the more you have more morbidities. Because one, like if you had TB and you have HIV, they might say, we treat first TB before we continue with the therapy. By then, maybe your body is not really feeling so great. And if you got maybe another infection like COVID coming in, then it complicates the whole dynamic altogether. Then you have diabetes now, then COVID and diabetes now, they have a different ballgame altogether. So all this affects how severe people really go through. And it will affect different ages. The elderly, the pregnant, the young people, all those ones are more at risk. And of course, the underlying conditions, like we already know, obesity severely reduces the quality of life. So good nutrition has a strong, what we call a positive relation with hospitalization and recovery, that if you're having good nutrition, your body is able to fight infection. Your body is able to recover better. And if you have other comorbidities, maybe you respond better because you have stronger immunity. So we need to look at how do we always ensure in our meals, are we having good supply of protective foods, the vitamins, full of food sources, vitamins and minerals, and vegetables and fruits have been very, very key in ensuring that you have that. It will increase your immunity, yeah, so that you get really better. If you don't have that, of course, your immunity is going to go lower. And of course, infection goes higher if you have poor nutrition. Inadequate intake, then of course, things like poverty, illiteracy, and more, it's not illiteracy that we have not gone to school, but knowing what to do in our case here. And if you don't have sufficient health services, some people don't have official papers to be in the country, then they don't want even to go to hospital. And then they'll be home suffering. And of course, that again presents more disease. So the cycle really continues. And nutrition actually is pivotal to everything that we really do. Any question here?
Not that I can see. Perhaps we can take some at the end. Yeah.
Thank you. So I want to talk on obesity because this directly look at some of the things I've been doing over years to ensure that we actually pull this one down. And when we have obesity, the comorbidity, when you have overweight, obesity is insulin resistance, you have glucose resistance, diabetes comes in, hypertension comes in. I highlighted here sleep apnea because I think some people may actually have and they don't actually know that you'll snore loudly. You have episodes where you actually think you have stopped breathing, or you're breathing during sleep, which would be reported by somebody telling you something. Oh, you actually, between this period, you're not breathing, but you actually don't know. And sometimes you gasp for air when you're sleeping, or you wake up with a dry mouth. I sometimes actually wake up with dry mouth, come to think of it. Or you have a morning headaches. So all these difficulties not sleeping could be a sign of actually you're having another comorbidity. Arthritis, we have all these and other types of cancer now are being associated to being obese. So it's really very important that we look at, again, the calendar, where we are. MOT is very important, looking at where we are. But it's evident to show that the more we have more fat in our bodies, we are likely to be obese, but then we have information saying that we are likely to get other comorbidities. We know that there is still continuing now research looking at obesity and psychiatric diseases. What's really happened, there's a lot of data around that. There's now information around genetics and how people actually are letting that with obesity. And I think within our community, we have had a lot of evidence that. Evidencing that. So gender, race, all these and the duration of association of these comorbidities are some of things that are really now gaining momentum. And there's a lot of data to show that actually physical inability and obesity are associated with diabetes. Diabetes is associated with a lot of comorbidity. So when we have anybody who is living diabetes, we need to find ways of understanding this to be able to manage. And those ones who don't, we need to work. Let's work really, really hard to prevent. Prevention is better than management of it. So evidence is there that we need to move better. We need to do more. Now with the winter, what are we doing home to ensure that we can still move more, but we're still confined in? I was just quoting here, Walt here, Disney, who said, the way to get started is to quit talking and begin doing. In our community, we talk. We talk actually about them. Have you done it? I'm thinking about it. Let's just transfer this thinking into actually doing something about it. Your son or grandchild or daughter might really like, a chocolate every time or sweets every time you come from work. Now, why don't you bring carrots instead of sweets? What can we do to change with the knowledge we have to make really things better? Instead of using ghee, why don't I use now maybe olive oil to cook? Let's try to, we have the knowledge now. We need to quit talking and save our community, save our families in the time that we have. For me, it involves a lot of collaboration to even just manage somebody who has comorbidities. And clinicians, organizations, service providers have to come together to work with you. And more often than not, actually, they don't do a good job. And every time you are chasing your mental health nurse, you're chasing this one here, at the end of it, you spend your time chasing services. So why don't we do something about that to stop that really occurring by ensuring that we take precautions and support or have knowledge or know what to do in terms of early prevention and management. I have put here communication, not just communication between the providers, but communication for you with the services you're working with. You don't hold information back and you want support. So let's be very attentive. Body MOT, our cars have that every year. Do we do ours? I'm asking that question. In management, what are we doing to manage what we have? Are we adhering to our treatments, or are we ensuring that we actually support anybody who has this not to go into other conditions? Are we communicating what we want to the right people? Do we have an insurance? Most of us have a home insurance. You have even your car insurance. How many of us have a life insurance? And when you start, is there any hand showing somebody has a life insurance?
Nope, nothing yet.
And when you go to get an insurance, when you have this, oh, I have cancer, I have now diabetes, I have now high blood pressure, the premium is going to be so high. Take this early so that if things really deteriorate, you already have what? You are sorted in so many ways that you can get some care somewhere. If NHS is waiting, you can actually use your insurance cover to get support wherever you're needed. So let's take care of that to ensure we are actually managing this. My tips for you are here. Tell your doctors about your condition and consider having your own treatment plan with them to ensure that you're actually managing. Communicate with your specialists and indicate medication you're taking. I know my brothers and sisters who take medication and they don't even know the name of the medication. They said the blue one, the white one, or that color. Write the name. Go when you're going there to discuss, this is what I'm taking, and this is how I am feeling. Sometimes you're given 3-4 medications that interact, and they actually might be causing a problem, and your doctor doesn't know, but you just keep on, oh, I was given this by the doctor. Let's have that communication in terms of managing comorbidity. Bring your medication to every appointment you take, yeah? And I know time is limited when you're talking to doctors, but nurses actually give you a better information. You have a chance, talk to the nurse, yeah? But let them know that this health issue is actually bothering me. 10 minutes, I'm not going to leave. I want you to know about this, so that in their record, they know you actually mentioned about the issues of a heart attack, you're mentioning about issues of arthritis, you're mentioning about, I have been forgetting everything, and maybe dementia just coming in. So let that conversation coordinate with your primary providers to ensure that you fit in their programs when something is going, and try to adopt a health lifestyle to ensure things that we have learned through these programs continue being better. And take all your medications again, as prescribed. Don't start sharing your medication. I know of some families where both man and woman are HIV positive, but the man refuses to test. but just takes the medication for the woman. And then, they don't want to take the assessment. So it's very, very important that you have to ensure that you are taking your treatment to ensure that you can treat any condition before it develops into something else. My message to you is that change is what you make. I wrote it so much in a bad handwriting so that you can actually remember it. And change is what you make. And I was reading here, Janet here, this nice photo here, where it was the quality of your life is determined by the character of those you invite into it. Not everyone is safe to know who you are, so choose wisely. But I wanted to change those ones to invite to say what you actually eat, like what you are putting in, instead of the visitor to your body is the food. The food is a visitor to your body. So choose to know that not everything you are taking in is really good for your body. Choose wisely, because if not managed, other things are going to develop. And if you don't eat well, if you have other comorbidities, then your situation are going to worsen. So nutrition has impact on our mental health, physical health, immunological functions, but also other respiratory diseases. Comorbidities, when you have obesity and diabetes, are really, really, really there and live. And management of this is very complex and require interdisciplinary teams. The costs are high. Morbidity and mortality is everyday life. So we can make sure that our quality of lives changes. But this, I would say, my colleagues, is in our hands. We, me and you included, can make changes and have a quality of life. Managing comorbidities. Thank you for listening to me. Any question, please?
Wow. Wow. Thank you so much, Dr. Gertrude. Can you stop sharing, please?
Okay.
Thank you. Very informative.
Yes, indeed, Sandra. Thank you. When I started with the introduction, I mentioned that we're going to have a special session. I think I should have said a complex session, but you managed to break it down. It's a lot of information, very insightful, but you managed to break it down, try to get us to take one or two things away with us. So I'm going to open the floor now. If you do have a burning question, please do put your hand up, and I'm going to call you, or you can just put it in the chat box. But I'm going to start with my own question. You stated that, we have the knowledge. I mean, every week we are having these sessions and we talk about healthy eating and, better lifestyle. What would be your tip or your takeaway message to someone living with comorbidities and still having or struggling to adopt healthier lifestyle, struggling to change their diet, struggling to incorporate exercises or physical activity into their daily lives? What would you say to such a person?
Thank you very much. I think for me, it will be keep it simple, but also do what you can actually manage. Sometimes you want to compare yourself to your friend or colleague or neighbor, what they're doing. No, just keep it simple. I can just start from, okay, I have hypertension. Now I'm going to cook food without putting salt. Can we taste food without salt? Or I'm going to reduce to minimal, and there's going to be no salt at the table. No salt is added at the table. Okay, we know we have diabetes, and we are thinking, okay, which food can I take better? Can I just change my white bread, brown bread? Just little minimal things that you can do. But also now get to know exactly what do I have. Some people don't understand the conditions they have. And try to find a way, okay, if I have asthma and I have also issues with what? With diabetes, what can I do actually in terms of me managing my asthma and manage it. So first, do your little MOT. Know what you actually have and what impact makes you feel. If I do this, I get really very tired. Now, which food can I eat actually that gives me a little bit of more energy than that without going over? So take first your own little MOT and get to know where am I? What do I have? What can I do? And for me, take the little steps. And it's not really, you are not always far from a call. Call and ask, this is what is happening. I just want maybe plan for me, maybe just 1 week to start off with a diet plan. Can you help me choose my foods? People will be there to be able to help you. So start slowly, but still enjoy your traditional food, but just prepare them really differently. So message to you, I would say, start slowly, know what you're actually facing, and see what help is there and what you can do for yourself.
Thank you so much. Thank you so much. I like the way you put it. Keep it simple. So healthy eating, healthy lifestyle doesn't have to be complicated. So for anybody struggling to be able to change their eating behaviors because they know that they are doing things they shouldn't be doing, start slowly. Like she said, reduce your salt.
Even chicken, we like chicken, just remove the skin. You know, if I always eat with my skin on, just remove the skin. Just keep simple, know the facts about what issues are, and just keep it simple.
Thank you. Thank you. That's really helpful. And I like the way you say, do your little MOT. So let's not just do MOTs on our cars. We should think about our bodies and do those MOTs. You talked about communication and you emphasized on that a lot. You know, you said a lot of the times we are given, or the doctors manage or treat our conditions because of what we tell them. So another thing I'm taking away is the fact that we shouldn't conceal any experience. And I think that boils down to you doing your MOT, whatever it is that you are experiencing, until you articulate that to someone, your healthcare provider, the doctor, the nurse, or whoever you are talking to, health experts, you will not be able to get the help that you need. And it's only when you articulate that you would know you're living with, you know, 1 or 2 or 3 different conditions. Thank you so much. Do we have any burning questions? We don't have a lot of time, just 2-3 more minutes, and then we end today's session. So please, if anyone has any question, please do well to let us know before I conclude today's session. Nutrition, this is a nutrition and lifestyle session, and she's emphasized this over and over again, that nutrition plays an important role in comorbidities. It could lead to increasing your comorbidities. It could, you know, make things worse for you. So we need to focus on a healthy lifestyle, which includes nutrition and keeping active. Okay, so if we don't have any questions, I'm going to draw the curtains. But before I do that, I would just want to ask Dr. Gertrude again. I'd like to hear you give us tips. Any final 1-minute tip? You've given us a lot, but what would you stress we take away? If anyone came late and didn't hear anything from your talk, what do you want the person to remember from today's talk, please?
One important thing to do, that comorbidities affect most of us, young, old, or whatever walks of life. Being from our African community or Black community, you are exposed genetically already to a lot of risk factors. So, which means if you get a condition like diabetes or obesity and all that, you are prone to get more issues. So it's very important that we try to prevent, or with that knowledge, we know we have that, we try to see what actually support is available that we can really work around. And again, once we have known whatever support is available, we need to be able to communicate, like you said, clearly what is the problem. Even at home, people actually have comorbidities, and some of their partners don't even know they're ill. So how are you going to get support when that's really not possible, that people really don't know what's the problem? I emphasize on mental health because mental health is a really big thing and it's affecting most of us in different ways. And with the economy, People are going to be even talking to themselves sooner or later, like me already. But things are going to happen. And if you want to feed even well and you don't have resources, there are going to be smarter ways of you actually feeding. Go to markets where, like, have a bigger market stock where farmers come and sell. Maybe you're actually going to get a quality of life. Know from your local areas who is actually selling safe things, but cheaper things. So mental health is a big thing, but nutrition will have to be at the center of this economic crisis. So don't put it aside completely and feed your kids wherever you get across. And like I said, it's very, very important that we make simple whatever we are doing. Let's start changing the way we live, the way we do things to better quality of life. We can make it when we make an attempt, than talk about it. So time to make action. And as little MOT is very important. Check yourself, secure yourself, ensure you look at all things around you. And thank you for listening to me.
Oh, thank you so much, Dr. Gertrude. I think I can listen to you the whole evening. Thank you so much. That was really, really informative and very insightful. My last words from me, and she mentioned that a lot of us Blacks and African and Caribbean tend to be more at risk. I like to use this quote: even though we are genetically more at risk, let's remember that our genes load the guns, but it's the lifestyle that's going to pull the trigger. Again, the genes load the gun, but it's lifestyle, which includes nutrition, physical activity, that is going to pull the trigger. So if we have a good lifestyle, we can make a difference. We may be able to prevent a lot of these things that we talk about. On this note, we bring in this first part of today's session to an end. Thank you so much for staying on. I hope you found it useful. If you do have any comments, please do let us know, send it to CAHN. If you have topics you want us to address or talk about that affects us as a community, please send all those suggestions to CAHN, send it to me, and we will address these topics together as a community. Next week, we're looking at intermittent fasting. A lot of people have requested for that. So if this is of interest, please do join us. And I'm going to hand it over to Shekinah to introduce our next session. Thank you so much. And thank you once again, Dr. Gertrude.
Yeah, thank you so much. Bye-bye, all of you. Thank you so much.
Thank you so much, Dr. Hiba, and thank you, Dr. Gertrude, for that informative session. So like Dr. Hiba mentioned, we're over to our physical activity part of tonight's session. So over to you, Orlando.
Hey, everybody, good evening. Thank you, Dr. Gertrude, for that amazing talk. And thank you, Dr. Hiba, for facilitating that talk. Right, people, it's the exercise portion of tonight's session. Again, we've got a fast-paced, action-packed boxercise session coming your way. If you remember what I said last week, these boxing sessions are becoming more intermediate to advanced now, okay? So we're teaching you more flowing combos, more defensive moves, and some harder exercises. All right, so for today's session, all you'll need is a big space. You'll need a mat, definitely today, and plenty of water, okay, to refresh and hydrate yourself. Right, so to start off with, we're going to start with a 30-second shadow skip. Or if you have a skipping rope and you've got the space in the house, you can bring the skipping rope in, okay? So we've got 30 seconds. Get yourself ready, people. Let's start this session off properly. Let's get the blood flowing. Let's get those joints warmed up. Find your spaces, people. We're going to go on the drop. Get ready. Get ready. 3, 2, 1, go. That's it, people. Keep it nice and light. Warm it up. Let's go straight. So jab crosses. Keep that going, my people. Keep that going. 3, 2, 1. Now, what we're going to do, drop down, body shot. Drop down, body shot. Let's go. Keep that going, people. 3, 2, 1. Okay, quick rest, people. 20 seconds. And then we will continue this form. 10 seconds left. Okay, get ready, people. So we're going to start off with body shots, okay? 30 seconds. So really warming them hips up, getting the core nice and activated. So we're going to go here. Both sides, okay? Get ready. 3, 2, 1. Give me 30 seconds, people. Let's go. Really twist those hips, twist those obliques, sides of the stomach. Okay, to the head now. Remember to punch at your face height, okay? Not down there, not up here. Punch at your level. Keep that going. 3, 2, 1. Shadow still. Drop to one leg if you can. Change legs. Back to 2. 3, 2, 1. Okay, last warm-up drill. In our guard. Push you from the back foot. 2 steps forward. Jab, cross, hook, uppercut. Push you from the front foot. 2 steps back. Okay, let's go. 3, 2, 1. Let's go. Jab, cross, hook, uppercut. People, 10 seconds. 3, 2, 1. Okay, 30-second rest period. And then we're going to go in the ring for round number 1. Fifteen seconds, my people. Okay, listening, my people. All right, so first round in the ring, we have a defensive combination round. All right, so nice and easy. For your first 60 seconds, I should say, as always, each round will run 3 minutes, and it can be broken down into 3 60-minute segments, 60-second segments, should I say, broken down into 30-second segments, and so forth. All right, this is going to be broken down into 3 60-second segments. All right, so for your first 60 seconds, you're going to be here, nice and easy. Jab, cross, hook, cross. Okay, work on that. Work on getting your power through it. Okay, jab, cross, hook, cross. Nice and strong. Don't forget about your body work, your footwork. Okay, here. Reach, bam, bam, bam. Nice and strong. And then we're going to add some slips and some ducks, but I'll explain that in the second minute, people. Get ready. So jab, cross, left hook, uppercut. Let's go. Get ready. Cross. Okay, get ready. 3, 2, 1. Let's go. Jab, cross, left hook, cross. Let's go. Keep working, people. Nice nod. Come on. 30 seconds. Keep going. Let's work it, people. 10 seconds. 2, 1. Okay, timer stops. Let's add to it now, people. Let's add those defensive moves. So, second minute now. Start off like the first minute. Jab, cross, left hook, cross. From there, we're going to dip our shoulders to the right, guard up. Slip right, slip left, duck down and around, bang, cross. Watch it again. Jab, cross, left, cross, slip, slip, down and around, bam, knockout cross. 60 seconds. Let's try that. 3, 2, 1. Put that together now, people. Let's go. Cool. Keep on, people. 30 seconds. Keep it going. Seconds, people. Keep it going. Three, 2, 1. Okay, last edition now, people. Last edition. So after that slip, slip, duck, cross, we're gonna add another slip, slip, duck, cross, finish with a hook. Okay, so watch it all together now. Big one now. Cross, left hook, cross, slip, slip, duck, cross, slip, slip, duck, cross, knockout hook. Quite a lot of punches there, people. Last 60 seconds now. Start off slow. Once you grasp it, speed up. Let's go. Go. Boom. Keep it going, people. Lots of punches from here. Let's go. Let's go. Keep it going. 30 seconds. Last 15 seconds, people. Come on, keep working through that combo. Five, 4, 3, 2, 1, and time, people. Well done. I told you these combinations are going to get more complex. You didn't believe me. Well done, people. 30-second rest period. Get some water down you. "15 seconds, people, and we're back in the ring. Round number 2. Okay, to the last 5 seconds, people. Listening while you're resting. Okay, next we've got combo / leg round, working on the old legs. All right, so throughout this 3-minute round, combo will stay the same and the exercise will still stay the same. So maybe give yourself a little bit of room for this one. Maybe start on one side of the room, because after you punch, your set of punches, I'm going to be doing an exercise. So watch me, listen in. Again, combo will stay the same. It's going to be jab, cross, slip to the right, cross. Okay, you're going to do that combo 5 times. Then we're going to go 3 lateral slides here, lateral squats. So 1, 2, 3, and then 3 back to your starting position. So here, 1, 2, 3. Okay, your aim is to get your bum nice and parallel, okay? Kind of low to the floor, kind of in line with the knees, if you can. All right, so combo stays the same. Jab, cross, slip, cross. That's 1. Jab, cross, slip, cross. That's 2. I need 5 of those. 3 lateral squats, and 3 back. All right, that's your 3-minute round, people. Let's get ready now. Come on. Let's get ready. So start off with your 5 combinations. Get ready. Drop 3, 2, 1, go. Nice lateral squats. 1, 2, 3. 1, 2, 3. So you do that, straight back to your combo. What's that? 3. Keep it going, people. 1 minute down, 2 to go. Keep working for me, people. Keep going. Keep going, people. Keep working, people. Coming up to the last minute now. Okay, last minute, people. Keep it going. Come on, keep fighting. 30 seconds, people. Keep going now. Legs should be feeling nice and burning right now. Keep going. 15 seconds. Come on, people. Finish up. Come on. 5, 4, 3, 2, 1. And time, people. Well done. Give those legs a much deserved shake off. Take your 30-second water break. Ten seconds, people. Two rounds down, 2 to go. Okay, listening now, people. Now, we have a cardio and conditioning round, all right? So lots of punches thrown over this round. So this round is going to be 3 minutes, and it's going to be broken into 6 30-second segments, okay, like I said before. So first 30 seconds, you're here. 10 straights, 10 uppercuts, 10 above the head. Straight back in. 10 straights, 10 uppercuts, 10 above the head. Once you've done that 30 seconds, we're straight into more punches. So from there, we've got jab, cross, duck, weave, hook. Again, jab, cross, duck, weave, hook. And you'll do that for 30 seconds. Then you'll go straight back in your punches. 10, 10, 10, 30 seconds. Then again here, jab, cross, duck, weave, hook for 30 seconds. Loads of punches being thrown now, people. Let's get busy now. Come on. So start with your 10, 10, 10. Get yourself ready. We're going in 3, 2, 1. 10, 10, 10. Let's go. Keep it going. 10. 10 seconds. 3, 2, 1. Defensive combo now. Let's go. Straight in. Keep on, people. 10 seconds. 3, 2, 1. No rest for the wicked. Back to your 10, 10, 10. Go.
Excellent on the track.
Going. 10 seconds. 10 seconds, and we're straight back into our defensive one. 3, 2, 1. Let's go defensive combo now. 1, 2. Keep going, people. 10 seconds. 3, 2, 1. Last minute. Back to you. 10, 10, 10. 30 seconds. Go.
Excellent on the track.
4, 3, 2, 1. To your defensive one now. Let's go. Ten seconds.
Espling on the track.
4, 3, 2, 1. And time, people. Well done. That was a sweaty round. That was a tough round. That. So take a 40-second break, and then we're going to finish off with our last round, which is an ab round. Well done, people. So bring your mats in now, people. Don't worry, you've still got 20 seconds left to rest. That's 10. Okay, ab round now to finish, my people. So we've got a defensive move or defensive combination, and then an ab exercise. All right, so this will be broken down into a minute, 30 seconds, a minute, 30 seconds to finish. So we're going to do our combo for 60 seconds and our exercise move for 30 seconds. All right, so listen in for your boxing combo here. So we're going to go jab, cross, slip, slip, hook, cross. Nice and strong. Just that combo there. Watch again. Jab, cross, slip right, slip left, hook, cross. Watch again. 60 seconds. Jab, cross, slip, slip, big hook, knockout cross. We've got that 60 seconds. From there, we're going to hit the mat for full sit-ups. Watch it. Down, there. Boom, there. Like so. Okay? So start with your combo. Jab, cross, slip, slip, hook, cross for 60 seconds. And then we're going to hit the mat for full sit-ups for 30 seconds. Okay, let's finish strong, people. Okay, start off with your combo. Get yourself ready. Shoes on. Okay, we're going to go in 3, 2, 1. Let's go. 60-second combo. Go. Keep it going, people. 30 seconds. Seconds, and then we're going to hit the mat. Keep going. Keep me that combo. Show me that combo. Five, 4, 3, 2, 1. Let's hit the mat, people. Come on, 30 seconds. Going. 5, 4, 3, 2, 1. Let's go straight back to your combo. 60 seconds. Let's go. Let's go. going, people. 30 seconds. Keep throwing that combo for me, people. Come on. Seconds. 10 seconds, then we're going to hit the mat for the last 30 seconds. 4, 3, 2, 1. Let's hit the mat one last time. Come on. People. 5, 4, 3, 2, 1. And time. There's that final bell. Solid 4 rounds, people. So give yourself a quick 20-second water break, and then we'll stretch off, people. Well done. Top session. All right, people, let's cool down now. Let's stretch off. All right, we've got alternate high knees to start off with. Let's go. Okay, hips, nice big circles. Change direction. Front to back. Okay, next side to side. Ear to shoulder, reach over every side. So down and reach. Wee. Okay, half moon, start by right. There we go. Change arms. Okay. Okay, legs apart. Turn your feet out slightly. Drop down into a squat. Elbows inside your knees. Push out. Hold. Up real slow. Shake it all off. And that's time, people. Well done. What a session. Well done, people. CAHN, you in the house?
Yes, thank you so much, Orlando, for that energetic session. If you guys want to put in the chat box how you found today's session, so if you found it challenging, if you found it easy, let us know, it'll be good. And Orlando, what can we expect for next week?
We've still got, I think it's 2 weeks left of boxercise, so another 2 intermediate to advanced sessions. I hope everyone's finding these like advanced sessions culpable. Just let me know in the chat box or whatnot. But just trying to give you a bit of a harder workout, especially for those that have been on for a little while now.
Nice. Thank you so much, Orlando. And next week, if you join us as well, the session will be about intermittent fasting, I believe. So join us next week from 6 to 7:30, and we'll see you then. Have a good night, everyone. Bye.
Bye.